Hi, it's Dr. Ahmad, cataract corneal refractive surgeon here at Harvard Eye. By now, you have probably figured out that you may have some issue with your cornea that's causing it to swell, and you have probably decided on proceeding with surgery. For corneal transplants, essentially, there are two procedures, both involving removing the innermost cell layer of your cornea. So, if this is our corneal layers, there's 5 layers, and what we do during the surgery is we go in and remove that innermost layer that's responsible for pumping fluid out of your cornea to keep it clear. Now, with that procedure comes a few things. You'll have in your folder a drop sheet that you'll reference as to know which drops to start before surgery and which ones to continue after surgery. So please look at your individualized drop sheet for those instructions. The main thing about the corneal transplants is the post-operative period. That is a critical time period where your benefit and your persistence to maintaining positioning is required. And so we really enlist on your help to achieve the best results. For the first 4 days after your corneal transplant, it is imperative that you follow your positioning requirements. In general, those requirements are laying completely flat for 2 days, and that involves every hour. So for every hour, you're allowed to get up 10 minutes to go use the restroom, to go eat. But if you're not doing any of those two things, then we want you laying completely flat. We'll see you the day after surgery to make sure things are looking exactly as they should. We'll continue the positioning requirement for another 2 days from there. After that, the following 2 days will be 50% on, 50% off. So for the first hour, you can be positioning flat. The second hour, you're able to get up, or you can do 2 hours on, 2 hours off.